According to the Philippine National Statistics Office, the number of senior citizens in the Philippines is expected to reach 7 million in 2010 and to double in approximately 16 years. It's no surprise that geriatric medicine has become a key medical discipline in the country today. Welcome to St. Luke's Geriatric Center, the modern facility that is dedicated to care for the elderly.
Geriatric Center is a pioneer center. No? In fact, we're 20 years from 1990. We've been operating as the first and only geriatric center until this year. The special thing about the geriatric center is really about the staff. No? This is the only center that is focused to the needs of elderly patients, especially those among 75 or 70 years old and above. We have a multidisciplinary team that are well-trained in handling geriatric patients. We have a clinical pharmacist, we have a clinical nutritionist, we have geriatricians that are board certified, and we also have a group of specialists that are involved in managing in an interdisciplinary manner. First of all, because of our experience being 20 years in the business, I think we have the expertise, and we are well supported by the state-of-the-art facility of the hospital, which helps us a lot in terms of diagnosis, and also the what we call the comprehensive geriatric assessment, which we try to give to our patients to diagnose and undiagnosed elderly common problems in the elderlies, especially we call it geriatric syndromes that are usually overlooked in a classical or in a very, the adult way of medicine. These are usually overlooked, especially problems like nutrition, depression, dementia, incontinence. These are usually an overlooked problem in the elderly population. These are the ones that we focused into.
Good morning.
What's your name po?
Crisanta.
Crisanta. So I'm going to ask you questions regarding the mini-mental state exam. I'm going to name 3 objects. Now, you have to repeat after me, and then you have to memorize that because I'm going to ask you later.
Yes.
Okay. Paper.
Paper.
Table.
Table.
Apple.
Apple.
Okay. You're good at calculation or spelling? Okay, let's start with calculation. Okay. 100 minus 7.
93.
Minus 7.
93 minus 7, 86.
Okay, minus 7 again.
79.
Minus 7 again.
Minus 7 again. 79 minus 7, 72.
Minus 7 again.
65.
Okay. What were the 3 objects that I told you to memorize?
Paper, apple, nakalimutan ka isa.
Definitely, we are not home for the aged. The geriatric center is an acute care center. We handle complex problems of the elderly who are sick. We call them frail elderlies. So they come here for treatment and diagnosis of diseases.
St. Luke's Geriatric Center offers long-term care, short-term rehabilitation, and ongoing routine and preventive medical care to adults aged 60 and over.
We have our services like that are not usually found in other hospitals. Like we have a daycare program where people who are ambulatory and relatively well can gather together, elderly people, and do socializing and some mentally stimulating activities to keep them from being bored at home or have some sort of stimulation. They do that on a regular basis. We also do a home care program for those people that after hospitalization having problems with following up to their doctors and to prevent acute illness from recurring.
The center's approach to taking care of older adults is holistic, taking into consideration their physical, psychological, and social well-being. The full-time staff working at the center includes highly skilled, fellowship-trained geriatricians and geriatric nurses. Our physicians are board-certified in geriatrics, and our experienced team includes nurses, pharmacists, social workers, and other professionals who specialize in working with older adults.
One other special thing about the Geriatric Center is the base of all the geriatricians that are practicing now in the Philippines. We have graduated 40-plus geriatricians distributed all over the country. We have, and still is the first and only pioneer program in clinical geriatric fellowship. We are classified as a specialist by the Philippine College of Physicians. Geriatrics medicine is relatively new in the Philippines, but actually it's been in the clinical field for more than 50 years in other countries. And the training of geriatricians is actually suited for especially those frail elderly 70, 75 years old patients and above, because they present special concerns. They have multiple complex problems that sometimes an ordinary doctor cannot handle. So we receive referrals from other specialties to look into these complex problems in a multidisciplinary and interdisciplinary manner. Our clientele is growing because of their good experiences with regards to the patients being able to go back to their previous functions, and with regards to issues that are not being dealt with when they go to the usual doctor, like psychological issues, social issues that the patient is concerned.
With the Geriatric Center, the senior members of the community can now live their golden years to the fullest.
Hindi ako papayag na sabihin mo lang sila. May pakinabang pa ako.
Oo, sige lang. Meron ako ibigay sa iyo mamaya.
Yuhu! Ayun na. Yuhu! Ang ganda!
St. Luke's Geriatric Center, the expert in elderly care. Ultimately, it is expertise.